Hi guys, Johnny here again, a specialist physiotherapist at Skelian Chiropractic, and today we are going to talk about a very common injury we see in clinic, knee osteoarthritis. So today we've got quite an exciting live patient testimonial and treatment, and what we're treating in this condition is arthritis of the knee. So the most common form, as is in this case when we scan in a second, is the medial joint line, so the inside aspect of the knee has some wear and tear developing. So you end up with some pain and swelling around the knee, and it's due to the fact that this area of the bone and cartilage gets a little bit worn away. But there are some really good solutions that we can offer. The two most popular products we use for osteoarthritis are either Ostenil Plus or Supplizyme. They're both hyaluronic acid injections, and they help lubricate the inside of the knee, relieving pain and stiffness. Now in this case, patient scenario today, this lady has had a previous Supplizyme injection 6 months ago and had excellent relief from symptoms, and would like a top up before she goes walking on holiday in the next few weeks. So we're going to show a live example of how we do that, and what we'll do now is I'll scan the knee and show you what we're looking for with arthritis. Okay, so ultrasound is very good for analysing knee injuries, particularly arthritis. So we've got the bright white line here, which is your tibia, and then that drops off into a clear joint line there, and then you've got this bone here, which is your femur, and those two together make the knee joint. Now what we can see in this case is we have some darkness here, which is swelling from the joint, which is a very common finding in arthritis. And then we also have a little bit of irregularity there, which we can see, and that is something called an osteophyte. Again, a very common finding with osteoarthritis. In this particular case, we are looking at a moderately osteoarthritic knee, and when you're in that level of osteoarthritis, they respond very well to hyaluronic acid injections. So what we're going to do is we're going to perform an ultrasound guided hyaluronic acid injection, and this will help relieve symptoms for anywhere between 6 to 12 months. Okay, slight sharp scratch here. Okay, good. And just going to wash that in, and another sharp scratch here. Good. And then we're just going to get that gel in your knee, and it's all over. Good, knee there. That's all done. So just clean you up and we're good. Okay, so that's all over with. How did you find the procedure?
I found the procedure okay. You do just feel the needle go in, but it's all over and done with so quickly. And with the ultrasound, you know it's actually going into the right place.
Yeah.
And you know it's doing you good.
Yeah, a lot of people mention how the ultrasound is so important because it just, it gets 100% accuracy, and
yeah.
it's really important.
Yeah,
and
you can
ha
actually see what's happening yourself.
Yeah.
You know, so.
And how have you found the response? Because we injected 6 months ago for the first time,
Yes.
and obviously you're back again today. So how was the result? What did you find?
I found after about 2 weeks, stiffness in the knee got better. Could go up and down stairs a lot easier.
Yeah.
Just walking, everyday duties just felt so much easier, and gradually pain-free.
Perfect. Well, there you go. And the good news is that because it's not a steroid, it's not a drug, it's completely repeatable. So we will probably see you again in about 6 months' time, and keep you going.
Definitely.